Hi occupational therapists, this video is just for you. In this video, I'm going to explain how to approach a writing task, how to use your 5 minutes reading time effectively, how to demonstrate the 6 assessment criteria in your writing, how to use the sample answer provided, and how to learn from completed writing tasks. So, let's get started. The occupational therapy writing test includes 4 possible types of letter: referral, discharge, transfer, and advice or inform. The reader of your letter could be to a number of different healthcare professionals, or to the patient or a family member. For example, OT to OT, or OT to doctor, or OT to patient, etc. Until you turn over the test booklet at the start of the reading time, you don't know which scenario it's going to be. The most important point is to be prepared to be flexible to meet any one of these letters and readers. Every patient is different. Their social background, their medical history, their current situation, these will all be different. Just like you wouldn't speak to each patient you meet during your working day using the same language and expressions, you need to be ready to use language and paragraph structure to make your letter personalised to this patient and this situation. Only then will you be demonstrating to the assessors that you have the English required to score a B grade or higher. Turning over the test booklet, there are 3 things you want to check as a priority. Although you cannot highlight or make any marks on your test booklet in the reading time, I'm going to highlight these 3 things so you can clearly see what my eyes are looking at and can follow the approach yourself. The first 2 pieces of information are provided at the end of the case notes, so go straight there and look for these things. Who are you writing to and what is their job role? In this example, we can see that we're writing to Dr. Timms, who is the referring doctor. What are you writing to the doctor about? Here we can see that we are updating the doctor on your assessment, recommendations, and plan. The third piece of information is back at the start of the case notes, under the notes section. What is your role in the patient's care? Here we can see that you are working in an outpatient's clinic. The patient has been referred to you for assessment by her doctor. We can also see that the patient, Ms. Miles, has had bilateral wrist problems since 2015 and was recently diagnosed with carpal tunnel syndrome, which tells me her healthcare situation. Before I start reading the case notes from the beginning, I want to make sure I have completely understood the reason for writing the letter. So another good place to check for any detail about this is in the last information in the case notes. From here, I can check 2 other pieces of useful information. That when I write to the doctor, I'm going to explain my assessment and suggested activity plan, which is postponed, as well as to make a review for 4 weeks' time following the changes that are being trialled. With this in mind, and remembering the specific reasons for writing this letter, to update the referring doctor about my assessment of Ms. Miles's wrist problems, I can start reading through the case notes line by line, deciding whether each one is relevant to the reader or not. To help make the decision, I will ask myself 2 questions each time. Is this case note relevant to the current situation? And will this case note affect how the reader continues care for the patient? If the answer to both questions is no, I can omit this information. If the answer to either question is yes, I will need to include this information somewhere in the letter. In the reading time, you have to make mental notes as you read for your understanding. I'm going to highlight the notes which I pick out to be relevant so you can see what I'm doing. The patient's name and date of birth are going to be relevant for me to include in the RE line, but her address is obviously not important. Some details from her social background I can pick out as being important relating to her current condition. She works in IT and she plays a lot of sport that will involve her wrists, for example tennis and cricket. I can also see that she likes writing. The diagnosis is going to be an important point of reference for the occupational therapist. The medication and past medical history can all be omitted because the reader would know these details already, and these are their responsibility rather than the occupational therapist's. The current history section would also be known by the reader, so can be ignored, while noting the last details about the physiotherapy and the wrist and forearm exercises and splints that have been provided for this condition, as well as the doctor referring the patient to me for assessment. The examination covers details that the doctor already knows, so the main section of interest for the letter comes from the discussion section. I know I'm going to want to read this in a lot of detail to make sure that I've really understood the situation I need to communicate. Almost all of the details are important, although the first 3 details about the keyboard could be summarised to show that we've talked about the keyboard and that she's agreed to try it for 1 month. All of these other details, though, are going to be important to me to include, so I take time to read these slowly and carefully, so I have this information when I come to writing my letter. From the plan, the second detail is important because it also mentions something that I'm going to do, to write to the employer to request alternative work responsibilities to reduce computer use, as well as providing the different keyboard. Having reached the end of the case notes and talking myself through the situation, I now feel I have a good understanding of Ms. Miles's history. If I still have time left out of the 5 minutes reading time, I would read through everything again carefully, reminding myself of the decisions I'd just made. Once the writing time starts, I would now underline those notes which I highlighted for you, so I have a clear record of the information I want to include in my letter. I would also turn to the blank page on the back of the answer booklet and make a very rough plan of my letter structure. A thematic approach to pick up on the main issues for the reader seems best for this situation. There was just one appointment with the occupational therapist, so I will cover the different aspects of Miss Miles's condition thematically. In the introduction paragraph, I will explain the reason for writing is to update the referring doctor on my assessment findings. In the middle paragraphs, I will include the important context details from the social background, my recommendations and plan. And in the final paragraph, I will cover the future steps I will take, including the letter to the employer and the review. I'm now ready to start writing. I have a clear plan in my mind, and it should be easy to record all the information in the 35 minutes I will have left and still keep some of this time to check my work at the end. I'm not going to write the whole letter now, but just to point out a few things. Opening my answer booklet, I'm going to start with the reader's name and the address, which I can copy directly from the writing task. Underneath this, I will add the date, which is today in the case note, 30th of August 2019. Next comes my greeting, Dear Dr. Timms, followed by the RE line. But remember that the order of the greeting and the RE line can be reversed if you prefer. So the RE line is Ms. Samantha Miles, DOB 25/12/1984. Then will come the body of my letter, the paragraphs. The introduction, introducing the reason for writing, then the context paragraph, the recommendations and plan paragraph, and finally the future steps paragraph. Underneath all of this, I will add my ending, yours sincerely, and finally my job title, Occupational Therapist. As you write the paragraphs, think about how you will summarise the information. The aim is not to write one case note per sentence. For example, the details about the keyboard can be summarised to only include the relevant content in one sentence. Once you have finished writing, use any time you have left to check your letter against the case notes you underlined to make sure you have included everything you identified was relevant. Read it as the referring doctor. By the end of the letter, do you understand Ms. Miles's current situation? If necessary, make edits to your letter if anything needs clarifying or adding. Now you have completed your letter, it's time to look at the sample answer. There are some important things to remember with sample letters for official OET tasks. They have been written and checked by both language experts and an occupational therapy subject matter expert to make sure they are accurate medically and linguistically. That doesn't mean they are perfect or seen as the only way to write a letter about these case notes. You might have used slightly different language or structure to your letter. Provided you have communicated the situation as per the task clearly to the reader, this will not be a problem. When reading the sample answer afterwards, notice the similarities and differences. If there are any differences, rather than seeing it as something that has to be corrected in your letter, think about why it is different. Why do you think the writer used this word or phrase? Is it more formal? Does it allow them to summarize some detail more effectively? Why do you think they structured their letter like this? Is there any difference in clarity between your version and their version? I want to finish off by giving you a few tips about how you can get the most out of this set of case notes after you've written the letter. Don't just discard this task and letter and move straight on to another task. Take time after each practice letter to learn from it and avoid making the same mistakes next time. Here are 5 things you can do to get the most value out of each practice task you complete. Assess your writing and the sample answer against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the 6 criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn. Read the evidence statement for each level and critically decide which statement is the best match for your writing. Type your letter into a document and check your language and grammar by using free tools such as Grammarly or spell checker and grammar functions built into your word processing software. Notice the mistakes that are picked up and use them to create your own checklist of common errors to learn from. Rewrite your letter so you have a perfect copy to refer to as you revise. If you keep looking at your original letter with the mistakes in it, you are training your brain to remember the mistakes. Having a perfect copy to revise from will help improve the accuracy of your writing. Use the case notes as the basis for a speaking role play. Imagine you are having a conversation with Ms. Miles in August. Ask a friend or colleague to play Ms. Miles's role while you ask her about the activities which aggravate her condition and provide advice. Search the internet for podcasts on carpal tunnel syndrome or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. With the right approach, the writing test is something everyone can do well. For more videos and test strategies, follow our social media channels on Facebook, YouTube and Instagram @OfficialOET and search the OET blog available on our website.